Have you ever wondered why some offices thrive, while others struggle from month to month? Even during difficult times, it seems like some offices are just unaffected. Maybe you think it's their location, or how much they're charging for their services, or maybe they're just plain lucky. Well, I can tell you for some that may be true, but for others, there is a formula for success. In this video, I'm going to share with you how you can work smarter and not harder to get the results that you deserve. But don't worry, it's not that difficult. Regardless of your office size, you can do it. We're here in Nashville, Tennessee, standing outside of downtown Dental. This is the home of Dr. Darren Clark. Just a few short years ago, he invested in some technologies for his practice and for his patients. And as a result, he renewed his passion for dentistry and saw a decrease of his expenses of $230,000 while increasing his revenues by $1 million. So let's step inside, say hello to Dr. Clark, and learn a little bit about his formula for success. You know, many dentists feel like they're struggling to get ahead, almost like they're running in place. Have you ever felt that way?
I have. Certainly the first couple of years out of school, I felt like I was stuck both in professional development and kind of financially with where I was going. And the same would apply for the first couple of years that we owned this practice. Revenue and production growth was not really growing that much. Slow uptick, but not what we'd hoped for. And then the other component of that is just professional development and feeling fulfilled in what you're doing.
So we stepped into a practice that was very dated. And when we stepped back and thought about where we wanted to be in 5 years and 10 years, we knew without a doubt that we were going to have to invest in technology to get us where we wanted to go.
Bringing technology in and incorporating it was going to be the key to growth. It was going to be the fastest way to growth, and it was going to help us both financially. It was going to help our patients with the quality of the care that we were providing. I wanted to go to work and be challenged and really enjoy what I was doing more than I was before.
So as far as your decision-making process, did you look at other systems?
Oh, absolutely. We spent a lot of time vetting the different companies and systems that were out there. At first, we were paying attention to a lot of the details, which system can do which thing. And that was really important, but very quickly we realized that we were paying attention to the details and not the big picture. It's really important that the system works very well together and that all the pieces of the puzzle fit, but it's also really important to us that we had the freedom to grow and adapt. Also, the company behind the equipment was really important to us.
CAD/CAM is a big thing for us because we are downtown Nashville in a very dense population area where a lot of people are really busy with work, so they don't have time to come back for multiple appointments.
CAD/CAM was really a slam dunk for us. It really is the biggest piece of the pie, so it had a huge impact on our practice very quickly. The ability to do same-day restorations, along with the ability to do multi-unit appointments, was great. We watched our lab bills go down at the same time that we watched our production go up. I will say it took a little bit of time for our team to get into the flow of things and really get efficient with it, but when they did, it was worth all of the effort.
From a diagnostic standpoint, having CBCT ability here in the office, just a short walk and pushing a button away, takes a lot of the guesswork out of diagnosis. We don't spend 2 weeks with a specialist referral trying to figure out what's going on because we can't clearly identify something on a two-dimensional radiograph. Put it up on the screen in front of the patient, we go through it together, and frankly, it makes a lot of sense to them to see something in 3 dimensions.
I think it's even more impactful if they have seen a provider in the past and they weren't really able to diagnose or figure out what was going on, and they come and see us and we pull up their regular x-ray, we can't see anything, we pull up the 3D image, and all of a sudden it is very clear what the problem is. And that creates a lot of trust.
It's been a huge asset for us because we're more confident in what we're doing. It's been a huge asset for our patients because time is their most important asset, and we save a lot of that for them compared to other offices.
Could your practice have experienced the growth that it's seen with any other technology?
We could have done some of it, but I think there are things that really set the Planmeca technology apart. For instance, I have very little concern about radiation exposure with any of the imaging that we do because we have the option to do an ultra-low dose scan. Secondly, and this was sort of a bonus with the ProMax that we have, the ability to do extraoral bite wings has really been a game changer for our practice. It saves our hygienists time in their recall appointments. It saves our patients from choking on intraoral sensors every time they come in, which they don't mention it all the time, but most of them dread it. That's been an incredible asset for us, and honestly, the extraoral bite wing function, I've gotten new patient referrals from that thing alone. The CAD/CAM scans will integrate seamlessly into a CBCT DICOM file. The software is incredibly user-friendly. Implant planning, prosthetic planning, everything is made exponentially easier because you can take the CAD/CAM piece and the radiograph piece, blend them together, and work within that system to do pretty much anything you want.
So for dentists that are trying to figure out whether this is right for them, what advice would you give?
Yeah, I think it takes a lot of time thinking about where you are right now and also where you want to be in 5 years and in 10 years. And when you're thinking about where you want to be in 5 years and 10 years, those are the dreams that you have about what your practice is going to look like and what type of dentistry you want to do and all of those things. And so that's important when you're looking at the capabilities of a system that you're considering and making sure that it will suit you well into the next 5-10 years that you've got. But you have to pay attention to right now as well, because that's where we're living. And you need to look at your services that you're providing right now already and the patients that you have in your practice right now already. And how can you better and more efficiently serve those patients?
The overall effect of incorporating these different technologies within our practice did a couple of things. It obviously improved the quality of the care that we were able to provide to our patients. It improved the health of our practice, including the financial health of our practice. But I think one of the most powerful things that I've noticed over the years of doing this is that when you bring the technology in, when you incorporate it and you hit it hard and you make it part of everything that you're doing, is these pieces of technology aren't a flashy thing you have anymore, they're part of the culture of your practice. And when that is the case, your team feels it and they're enthusiastic about it, and your patients feel it and they're enthusiastic about it as well. So the end effect, and I think the most important thing that it causes, is our patients have greater confidence in us than they ever have before. And that really strengthens our relationships with them.